to do any of this?
I'm not on camera. I don't really feel the...
Oh.
You're not gonna
Suffer with us?
I'll suffer in solidarity.
Okay. Just not on camera.
man. The packaging is actually my finger.
Oh, it's sticky. Welcome to Friends Living Well, the podcast. I'm Kelsey. I'm a BCBA. This is
Nikita Mahone, a licensed professional counselor, and we've made huge
life
mistakes.
decisions that are bad because we are gonna on this rendition of sour ones where we try sour candies to see if they're actually gonna help you with a panic attack.
There's no way that you are getting through the podcast, film or audio, how viscerally disgusting just holding this thing is.
It's giving like a little bit of a cucumbery smell. Apple, like a cucumber apple.
Oh, it is.
So I don't know if it's gonna
Oh.
be full pickle.
So basically, as Kelsey was saying, once a long time ago, we thought we were big cute, and we talked about how sour candies are one of our favorite ways to stop panic and anxiety attacks,
Yeah.
which started
It started normal.
Just
Which it felt
normally
normal.
Airheads, right? Just like a normal. Well,
Yeah.
now things have escalated.
For some reason, we've gone into this lane of pickle. It started with the pickle cotton candy.
We're trying to find what are the most sour things,
Yeah.
and it's led us down a weird
And
road.
look, guys, we do have like other things here. Like we have some really sour stuff, but I don't know why, but these pickles were just calling to me because they just sound so disgusting.
Start here.
It feels so much worse in your hand.
Oh, you're physically touching it. The look on your face. is
Stop
so
it. I
bad.
fucking knew he was gonna do that.
Oh, producer Cam miss out.
Wow. We'd have
Two
to charge.
hands,
We'd
two
have
hands.
to charge the. We're gonna we're gonna have to have a premium subscribe on our Instagram to show what Top just
We'll have
did
to
with
start a
his-
Patreon
with his
just for
little
that.
pickle.
Oh man.
How the fuck do you open?
So yeah, these are goopers
I can't open this with
from
my
China.
nails. Can you open this? for me?
Sweet pickle, artificial flavored, poppin' sour pickle juice.
You open that for me.
Poppin' sour.
Sour juice.
Don't ever say it again.
Poppin'. This pickle be poppin'. It's gonna be so bad.
I touched it and
Ew. Oh,
Wow.
Ew, it's
I
so
can't believe I'm
gross.
about to put that in my mouth
Ew.
hole.
Oh my god, it's disgusting. It's so phallic.
Oh, I dropped it on myself. I dropped it on
Nikita's has lint on it.
Oh god, that's probably gonna make it better.
Okay, are we all gonna eat
It's
it?
so shiny. I definitely got a hair on it. Look at this.
Wait.
See, it's fun.
Mine's
Doink.
bigger than yours.
Definitely bigger than Tom's.
I don't wanna.
Trash can, please. Right now.
Why? Why? I think we just got cancer. I think.
Can you guys see the juice?
That was one of the worst decisions we've ever made. Why did it taste like that?
Ew, that was weird. It's not even.
It was hard to chew through, first of all.
It's not pickly
Not at all
at
pickly.
all. It like is a weird flavor.
Pickle in appearance only.
It's like this weird appley cucumber.
This is a
flavor?
no, guys. This is a no. If you see this, don't get this.
But now my hands are sticky. I hate that. I really hate that.
Prison and jail.
Okay, let's do some deep breaths.
I just put my fingers in my water.
Starburst palate cleanser.
Yes.
Yeah, that's gonna. Please, sir, can I have some more?
Wait, I need a different flavor. I hate cherry.
Here.
Oh, so much better. Wow. Okay, so poppin' pickles were not it.
Why?
But if you
Why?
were panicking and you tasted something
That
really
would-
bad, it would probably distract you. Because it was really fucked up. That was disgusting.
I just imagine a boardroom full of people agreeing that that was a good idea to mass produce.
I don't even think it got that high.
In post-apocalyptic America,
Wow.
the only food available is guppers.
60 calories per one.
Get the fuck out of here.
And
Huh?
14 grams of sugar.
And a single pickle?
Yep.
Not worth it, gang.
That's half a Red Bull.
And one of these little bitches.
Half a OG Red Bull, not sugar free.
Well,
This helps.
that made everything better. Sorry for the chewing, y'all. Might have to cut that out. Mouth noises. Pleasure. Mouth pleasure.
We came in hot. We came in hot this episode.
That was the worst one we've done yet.
I thought pickle cotton candy was gonna break me.
Oh, that garlicky pickle. I really like that. That made my breath stink.
Yeah. She liked it in a weird way, but that's, whatever
It's not
floats
something
her
I'm
boat.
proud of. It just happened that way.
Well, the next one we try is definitely going to be better because the other ones that we have, this extreme sour blue raspberry sticky bears from Mama V's sound really good.
Yes, we were not as impressed as we wanted to be with the other Mama V's candies, and she swore to us that these extreme sour blue raspberry bears were top
better.
notch and sent some extra
Wow.
sour sugar with it.
And we also have this extremely sour little sauce. Souracha is what it's called.
Okay, cutie.
So we can really up the sour if we need to.
Okay. With your cute nails, just being all cute.
Oh my gosh, they're so long.
I love them.
They're fun. I feel like very cunty in them. Like
You
I'm
are-
doing a
yeah.
lot of pointing.
Put your cup and do that.
I won't do that. I will not do that. I did actually flip somebody off in the car ride back from your house yesterday.
And you
'Cause
were
they
like,
cut
it's
me off,
extra
and I
better
was
with
just
these
like-
nails.
I was like,
Fancy.
yeah.
They
So
are
that
super
felt
cute.
good. But I'm going to get new ones. I'm going to get them done on Wednesday because they're so long. I can't function.
I'm sorry. For a second there, I couldn't even focus on you. I could just feel that pickle in my mouth.
It's actually kind of lingering like a bit. And now I have
Trying
two
really hard.
flavors. I have the Starburst flavor, but a little pickle remnant. Not great.
Why was it like the foam inside of a mattress? Why did it have that kind of consistency to it?
Oh yeah, give me a pink one. This is gonna be the last thing that I eat on camera because I can't keep chewing this into the microphone.
Do you need help? You little
Yeah.
nugget.
See what I mean? I can't do shit.
Well, you're just a girl.
I'm just a girl. Wow, that's good.
Here you go,
She's so efficient with her opening.
I muted you.
Oh, smart. All right, did we do all the intro stuff that we're supposed to do of full living wellness? And we talked in the last episode about all the fun updates that are happening. I'm really excited for groups that are going to come up, but that's something we'll have to get to, especially when staff gets figured out. You already know the one group that I'm really excited about because it's more experiential and it's about incorporating trauma and your drama and having a place to get it out, and I'm super excited for it. But we'll
Trauma
have
drama.
to, once we get some more details about like where it's going to happen, when it's going to start, we'll we'll talk about it. But I am super excited
I
about
feel like
that.
that's gonna be a group that's gonna fill up pretty fast.
Yeah, that's going to be so fun. And then my favorite part is if everybody chooses to do a show, whether that's just for like us as the members or for their loved ones. It's such a cool end of a group thing to have happen.
Because I was also thinking, like, would it be fun to have any of the caregivers of any of the people, like, especially in my group, because I was thinking about doing kind of like a cozy situation post holiday, and I was like, wow, should we like invite their parents and then they could all kind of like meet each other? I don't know.
I love all these ideas.
We got a lot of ideas over here at Friends Living Well
Hell
and
yeah.
Full Living Wellness, so that's pretty fun.
Yeah, so we'll keep you guys updated as we go.
Yeah. And last episode we talked a lot about seasonal saddies. We also talked about being supervised by great supervisors. So
Saddies for the baddies and supervision for the baddies.
And this episode we have quite a few questions.
Yes.
That now
Y'all.
tell me how you got these questions, because I don't know if I asked you.
So, I work with someone who is a professor at St. Joe's University, and I offer some consultation and some supervision to them. And one of their classes had a whole bunch of questions that they just asked if they could send in to us, and if we could little by little pick away at it.
That's pretty
And
cool.
there are so many questions
They're
on here.
good questions too. Like
There's
their questions. What is that? What are you doing? You're clapping? Okay. If you do stuff back there, I can't tell because I don't have my glasses on.
He's given respect.
Respect that.
Okay, so I really liked, and I guess it's a good place to start. A number of them are asking basically about that idea of like a little trauma versus a big trauma, which I totally want to get into, but then it made me want to ask you a question before we get into anything, which is, how does trauma apply to like ABA? Like, I almost wanted to be like, what does trauma means in the ABA world? Like, what is that? But before we even do that,
Yeah.
I wanted to put you a little bit on the spot, Tom, for like a general, when you hear the word trauma and everybody talking about it, what the hell does that mean to you? Like, what do you assume it means?
What I assume it means?
Yeah. Like, when you hear about it, you see people and they're like, oh, my trauma, or I have a traumatic experience, or this is trauma. What are you kind of assuming that means? What is trauma?
I think physical pain. I think emotional pain, or like anguish, like something bad. It's like something really bad. I associate it with bad.
Something bad.
Be it like, a near-death experience, or like a near miss, or something that stays with you that you can't shake.
What if somebody's like, I dropped my ham sandwich on the floor and I was traumatized? What do you think of that kind of?
That sounds like people adopting vocabulary words that they hear online into like their general lexicon and stuff, and it kind of unfortunately waters it down a little. And just like how I talked to Kelsey before privately about like people are calling themselves autistic because they self-diagnose themselves with a fucking infographic online, and I feel like it takes the meaning out of stuff, or something,
Yeah.
like it takes the seriousness out of it.
Yeah.
You guys already know my thoughts on self-diagnosis, so I'm not gonna dive into that right now. But sometimes self-diagnosis is really important for people that can't get services. But I hear what you're saying, Tom. I just wanted to throw that caveat in there.
Yeah. And I really like that start of what you gave, Tom. Thank you so much, because I feel like I know I was like putting you on the spot, but I wanted that, like, because it's a term that's everywhere. And I felt like being in the profession, you and I are going to have a way different understanding of it than, say, Tom is, where he just like hears like somebody at work saying this thing was traumatic, and like, what is that?
Yeah.
And it feels like you have like a pretty classic idea of trauma too, where it's not necessarily, but it sounds like your definition is more like life threatening in some way, like pretty extreme in some kind of a way.
Yeah, because you said physical pain.
Physical pain,
Was
or
the
like
first thing you
emotional,
said.
like really being pretty
Yeah.
pretty big.
What would you call it then? So that's kind of like a layperson interpretation. What's the thing that you think of when you think of trauma?
I think, I mean, that's where, when it comes to like a classic trauma response, and that way, like classic PTSD, it falls a lot into that realm. To me, it's anything that overwhelms your capacity to cope. That's the classic definition of a traumatic situation. Other ones that I've heard that I really have always resonated with, it's when you believe that either your life or the life and well-being of somebody you love is truly in jeopardy in some way. And so then, we're at our capacity of control, and can I protect myself or somebody I love? Can I do anything to prevent this? And if we feel like we're not sure if that's possible, or we're not able to currently, then we start entering into a trauma realm. But the whole conversation really opened up, and these questions reminded me of it, because of a lot of people asking, where does that like fall? Like, it's really easy to discern a natural disaster,
Sure,
or somebody being attacked. This is clearly trauma. But where on this realm of these life experiences, when we start spanning into things like stress, uncomfortable, distressing, or painful experiences, where does that realm fall, where that's a better descriptor for these things versus trauma? And so that's what I heard a lot of these questions when they're asking about like these ideas of, a lot of these questions are, what are big T's versus little T's, or what is the difference for treatment, and how do you talk about big T's versus small T's without minimizing those bigger or larger ones, which I feel like really speaks to what Tom was saying. Like, how can you recognize the impact on what might be considered a smaller trauma and still not take away from these huge traumatic experiences as well. So that's where I figured we'll dive like into more.
Yeah, because I think what you've taught me about trauma and stress, how I think of it is like, stress is something that is still within your capabilities, but it's taxing. So, it's challenging cognitively, physically, emotionally, psychologically, but it's not to the extent that like you lack resources or control or coping strategies. Whereas I feel like what you've taught me about trauma is that it really is truly this like fear or sense of danger, or like this life-threatening experience. When I hear little T's, I also think like adverse childhood experiences, because that's my framework. And now again, there's a lot of big T's in there, but I think I've worked with quite a few children that have had a big T, but then after the big T, it's like all of these little
confounding
and it's like all of these compounding factors, right? Like, it's like, this one child that I worked with was a kindergartner who lost his mother in a fire. And then it's like, okay, but not only did you lose mom, but then you have unstable housing, and then because of the unstable housing, you're there's food scarcity, and then, you know what I mean? And it's just like over such a long period of time too. And that's just, to me, like the challenge to the nervous system
of having such different experiences of like that one, maybe that like one exposure for your central nervous system versus consistent or everyday or random, or maybe very expected. And then what does that do to your central nervous system?
And like safety, like where is safety in any of that? Like I just can't imagine how that feels. That's like the privileged standpoint that I'm able to come from. I didn't grow up with food scarcity or housing insecurity or things like that. And so that's why, like, when I hear big T, little T, and then I think of like the little children that I'm usually working with, it just feels like a whole different beast.
I think, per usual, your instincts are dead on. Because when I was thinking about this for myself, I was like, what? Big T versus little T. I was like, bringing me back to grad school days myself. I was like, what? And then what I really recognized for me, it was breaking it down to was like a classic presentation of PTSD versus complex trauma.
Which like, we were just talking about yesterday.
Right? Yeah, we were just on this topic yesterday.
Would you maybe want to like, so what we were talking about EMDR.
Yes. Love EMDR.
And Nikita shared like a point about EMDR that I didn't understand. Like, that's not my clinical specialty. So would you be able to maybe describe in your like clinical opinion, like when EMDR would be helpful versus when maybe you would want to like have a combination of approaches?
Yeah. And if I get lost in this, bring me back to
I'll try my best.
Because we were talking about this yesterday, and I love EMDR. I know it's going around as kind of like a buzz approach right now too on social media, which is good that people are just learning different modalities of treatment in general and how to have these conversations. But I have found that EMDR is really effective with more classic presentations of PTSD and trauma, versus I have found it to be much less effective and sometimes even re-traumatizing if we try applying that same model of treatment to complex trauma. So I have found if you're somebody that has maybe a singular traumatic experience or one particular traumatic experience that you want to reprocess, which is the whole point of EMDR, like maybe a car accident or a house fire, like you said, can be super helpful, like especially if you're finding yourself like and having like a lot of flashbacks or going back to a particular experience, like a patterned way of doing that with your trauma. I have found EMDR to pull people out of cycles like of flashbacks and things that they have otherwise not been able to get out of. So it's very helpful in that way.
Yeah.
But then when I think of complex trauma, that really becomes a trauma of self and self to relation of others. So this is usually like when you were talking about somebody, it's usually in childhood, it's usually having multiple experiences of it. And because you're at a younger age, that usually indicates that there was somebody in your life that should be taking better care of you that isn't. And so that is what partly makes that trauma relational in that way, because now you're trying to figure out what this means about you. That's usually the first thing we see with anybody that has complex trauma as a distinction. You have a lot of symptoms that are with classic PTSD, and then you have some additional ones. And those additional ones tend to be the way that we think and feel about ourselves. So this can be about even being connected to our own bodies or a self-awareness of what our thoughts and emotions are. But it also comes down to sense of self. Do I have of inherent value, or feeling very shameful? Like I think anybody I work with that has complex trauma, one of the easy narratives is I inherently am less valuable than other people.
Yeah.
That's just like a belief that I've heard from it. They've like, oh yeah, that's always been a true thought and a feeling.
Yeah. And I feel like even in just how you're talking about this right now, it kind of highlights that even the way that that question is posed, that it feels like there's a comparison or like there's an opposition of big T and little t. But I think what I heard you just describe is a little bit more of like, it's a spectrum and like it might vary.
Yeah.
And for some people, it might be like this approach is helpful for maybe this experience, but maybe I need a combination of approaches for some of these other experiences.
I think you're exactly right. I think that that's what they're picking up on instinctually too, is they're starting to practice, because that's what all these questions are coming from students that are currently in practice. So they're not only learning all the theories and all the definitions, but then they're trying to apply them. And they're probably picking up on, which is what I definitely experience as well, which is that the tools that work for a classic presentation of PTSD are going to be vastly different than the tools I'm going to need to work with somebody with complex trauma.
Yeah, and I feel like you won't understand needing a different methodology or treatment package until you're doing the work and you're in it and you're like, oh, but I did this thing that I learned in the textbook and it's still not meeting the need here, and now this is where you... And I think this is the thing that probably brought both of us maybe even into the field in a way, is like the creativity of it all and the intellectual stimulation that I get from problem solving and learning. That's so valuable,
because everybody's so different. You have to formulate an entire plan just for them.
Yeah, and we were just talking about that yesterday too. I was talking to Nikita about how at the institution that I currently work at, not Full Living Wellness, but the institution that I work at full time, how they use a standard methodology in some capacities. They use literally like, we do this step, this step, this step, and this step. And then there's like a handful of kids that don't benefit from this by the book, step by step by step. And me as a BCBA being like, you can't use one standardized curriculum for everybody. Like, what the fuck are you saying? But that's like, I think that adds evidence, right? Is like, for people that are maybe even familiar with like multi-tiered systems of support model in schools, there's universal strategies that benefit 80% of kids.
Yeah.
That might be where we have a standard by the book, go here, 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 and
some
here.
helpful places to start.
And then when we get to more of like the people that need individual support needs, and then the ones that like really have that like high needs, that's where we start getting super creative with very individualized supports. So that question, my answer to that, even though I'm not the trauma expert, would be like flexibility and problem solving.
No, that's exactly correct. Being very person-centered.
Yeah.
You're not going to have you have to be very collaborative. I think that's something that really stands out to me about specifically complex trauma is.
Oh, yeah.
Because it's so relational.
Yeah.
Even my last session just this past week was actually with someone who started the session by saying how they almost canceled because they had that part of them that was like, don't want to do it, don't want to talk about it.
Yeah.
And that's another feature of complex trauma is we like to avoid. We don't want to have to deal with that thing or talk about that thing.
I love to avoid.
And so, but it was a really beautiful set because one came in. So
and
like
told you.
And said the thing. And because of that, we were able to work on our relationship of me being able to say, one, thank you for doing that. And two, that's so important because there's a part of you that's trying to tell us we maybe need to slow our pace.
Yes, because it's not feeling, there's something there. And that's another thing that you've taught me is like this intuition and this sense of self. Like there's going to be parts of you that are not going to want to show up. Yep. And like, could that maybe be some trauma response? Sure. But it could also be because something is happening that maybe it's not working for you, and that's okay.
Hell yeah. Maybe last week when we talked, it was super rough and you're still processing that stuff. Maybe you just didn't sleep good that day, and today is just not the day to get into it.
Exactly.
So I go into that strength place, which I know is a place that's core to you and you always go to.
Yeah.
As well as this isn't a bad thing that we need to slow the pace down or that this part is coming up and is being hesitant.
Yeah.
Let's listen to it, use guidance from it.
Yeah. Yeah, and I think that in my practice, when I think big T or I just think trauma period, a lot of the time what is giving me that signal is externalizing behaviors.
Yeah.
So it's not like somebody coming, it's not a child coming up and being like, this is how I feel today, or like, well, it's not
That'd
like
be a creepy ass little kid if they
it would be weird.
Imagine?
And it's not like a conversational thing, right? Yeah. It's like I'm observing this child, and then I'm observing that like all of the sudden maybe their behavior is happening in a different topography. And I had this moment with one of my colleagues at CHOP, and she said to me, I have this kid and they have recently started pulling their pants down, and they've started to do it in these specific contexts. And I asked a lot of questions because I said, there are individuals out there that, need support with understanding social nuance of like, what is a safe way to communicate with people? What's an unsafe way to communicate with people, right? So there are some individuals I've worked with that, they're seeking connection with other people, and maybe we're finding it in those ways. In this situation, this was a behavior that was never observed before. It was something that had a very recent onset, and it was happening in very specific contexts. And based on my experience previously, I was using this externalizing behavior was ringing an alarm bell because the only time that I've ever seen that externalizing behavior in other children were children that I knew were victims of sexual abuse.
So there's like a pattern there that you were picking up.
It was a behavioral pattern that had never been demonstrated before. It all of a sudden started happening, and it started happening in the context of like family interactions. It wasn't happening at school. Yeah. So there was just these things that I was like, I think that you really need to double check this, because like I'm having a gut instinct here of that this is not just, we can't boil it down to this is an autistic person engaging in like different types of behavior, right? Which I think is not something I've ever said or will say, but I think that it's really easy for people that don't have a curiosity mindset. They kind of start and stop at the behavior. They're like, oh, they're misbehaving. They're inappropriate.
Oh man, we do that so much in general. I could see that absolutely coming up with kids, like even more
Even
so.
Even neurotypical kids, right? It's so easy to be like, oh, they're just 5. They don't know any better.
Yeah. We do that like so we just assume what each other means, and it's like you probably are partly right, but we're all so similar too. Like there's some similarities there. Maybe be a little more curious. Like open up to the extra question of figuring out for them where it's at.
Yeah, and she investigated and explored it, and we were right, unfortunately, for that child. But it meant that because we were inquisitive, it means that we actually were able to get them on a track to get the supports that they needed much faster.
And imagine if you hadn't noticed that.
And thank God that I have a trusted working relationship with this person. Like that gives me that's such a compliment to me that she came to me and she trusts my instinct, and we were able to kind of like work through this difficult situation together. So I think that, you know, for my educators, special educators, paras, whoever, you know, you're working in schools and you start seeing some different behaviors like that, be curious.
Yes. Oh, that's such a good reminder of I know we're talking about trauma, but as always, trauma, grief, and loss falls like into that same. And as you're talking about the weird behaviors that people can be so judgmental of and so quick to, it's grief.
Yeah. Yeah.
Man, that as soon as I even think, I get so angry for myself and for so many people that I work with, where grief, people become so assumative of how people are feeling or what they need or what they think or the curiosity just goes out the window.
Yeah.
With them, and it feels like their whole story goes out the window with that as well until you slow down and
stop asking. We don't even start asking, right? No, I think that that's something. So I think that like when you're working with children, it's going to be a little bit different. Other things that I've noticed, again, this is not like psychological signs, these are behavioral signs, but it's really like a significant change in pattern of behavior, or like really big uptick in self-stimulatory behaviors. Now, I do see this across the lifetime, like developmentally. People go through phases, and some people really enjoy self-regulating in different ways. But specifically for like the autism population, if there's kind of this abrupt shift, where we're really lacking emotional regulation all of a sudden, that's where I'm like, what's happening here? It's a little different. I also think back to a situation where I had a kid in schools that was highly dysregulated, extremely physically aggressive. But I also remember that they peed their pants during dysregulation.
So that's another question that's throughout this a number of times, is people asking about, I'll call it like sexual organ or just like body fluid focused expression in that way, whether it's spitting or feces or urination or exposing self.
Because that was one of the questions.
A lot of the questions, and particularly with kids, like what does that mean potentially of children that are doing these things? Or
it's the curiosity mindset. You know, we can't speak in absolutes about any of this.
Like this means for sure this.
I you know, you can, it's nuanced, right? I've worked with individuals that engage in, you know, and anybody in the comments, you can maybe tell me a better way to say this. That's maybe a little more strengths-based, but like if we're engaging in fecal smearing or we're playing with feces, I've worked with individuals that have really high sensory needs, and they're finding it in different ways. I didn't know the background for some of those individuals, right? But I've also worked with like children that were like very tiny babies that were curious about those things. And so could that be sensory driven? Sure.
See, because I would think that most like the lay person would assume like if you're doing like feces stuff, like it must be like sexual abuse or like it has to. But I hear you saying like, okay, maybe it could be like that, but
totally
could be something as more simple as they're sensory seeking, and this is just another tool that they have that provides sensory input.
And I also think too, also coming from like, think about it from like let's boil it all the way back to like a skills thing or like a feeling thing. Imagine having this feeling that you need to defecate. You don't understand that because your body and your brain are talking in different ways. So you don't really understand this pressure. And then when you find a way to relieve the pressure, then you're like, okay, like how do I get rid of this? Or I'm curious. So maybe I'm doing things curiously. Maybe I don't know how to clean myself effectively.
Or even how much better you feel after you've gone to the bathroom. Like, I can almost see somebody like maybe confusing that and being like, well, I want to feel better about this situation I'm in now. Can I do something that's related?
Thing that feels good, right? So again, it's like, but that's where I'm like, regulation need, sensory need, regulation need. Like that's where I start asking questions. But then I've also been in situations where there's individuals that maybe are lacking resources, they're lacking connection with other people, and they're finding ways to connect with people and self-soothe in like by using fecal, smearing and things like that. So, it can be in a lot of different categories. I think it's important to be curious.
Yeah.
To be like, what is this history? Because that's the thing that I didn't do a good job of as a BCBA up until I worked in a medical institution of like, what is their medical history? What is their birth history?
Yes.
What are the medications they're on? Are they eating? Are they sleeping? Like, those are those very basic things that I think other professions come at first. Right? Whereas behavior analysts, it's like you see a behavior, you treat the behavior. You see a behavior, you treat the behavior.
That's the idea, right? Simplify it, focus just on the behavior, and then...
Yeah. But then you learn more and you work with different people and you collaborate with other disciplines and you're like, oh, I actually don't know shit about shit. So I should probably like think about this a little bit harder.
Feels like a bit of a top-down system a little bit when you put it that way. It's like the behavior's up here, and sometimes maybe you can just focus on the behavior and apply some, and then, but other times you might have to go through and figure out like what happened to this kiddo from birth to that's led to this.
Yes. Like I just did a consult for a child that was adopted at 12 to 18 months, was exposed to substances in the womb, and is having some challenges during therapy sessions. And within the therapy sessions that were being provided, they were doing timeout procedures. This child experienced substances in the womb and adoption. So think abandonment.
Yeah.
Think emotional abandonment.
And then leaving them in a place.
And then telling them you're having a big emotion. I'm going to sit you here and you have to stay here.
Good luck, boo.
Go have your emotion. By the way, they're like 8 years old. Like that was when I had moments like that where one of my friends who's a Lauren Elder, you can follow her at the Holistic Behaviorist. She has her own agency in Delaware. She was like, anybody that's writing planned ignoring into my kid's plan that had substance abuse, like issues in the womb and were adopted, like we're not doing that.
Dude,
we're
no
not
wonder
doing
ABA sometimes be known as like abusive. Like planned ignoring
is
like,
crazy.
whoa, that's so
work.
Extreme.
It's so extreme, and like there's so many. So like think about it this way: planned ignoring. The reason why that is a suggestion amongst behaviorists is because we're identifying a function of attention. This behavior is happening for attention or engagement. So I'm going to withhold that. But if I know there's a need and then I withhold the need, why would that behavior ever go away?
Right.
Why wouldn't I give you the thing that you need to help support you prior to things escalating more? Like, the absence of this thing is not, and never providing it is never going to be an effective intervention.
It's so odd because it feels like they look at it like a math problem. Like do this thing, reinforce with this thing, and you'll get, and it's like, okay, maybe sometimes, but otherwise, like in terms of a human interaction, abandonment, like that's punishment, that's torture. So it's like, it's not just like this reinforcing variable. It's like there's this huge human component to it.
Yes. It's the same thing with the compliance, like focusing on compliance over emotional regulation. The function of the behavior is to escape. I don't want to do this thing. So behavior answer, make them do the thing. X, A plus B equals C.
Yeah.
Right? But you're missing all of this.
The things in between.
Right. Why is it so difficult? Is it within their capabilities? Are they being felt and heard, and do they have choice in what they're doing? Like, there's so many other things that you could be doing.
This is when it becomes so clear of like this idea of masking, which I know gets thrown around so much, but when I hear you break it down this way, I imagine a kiddo, like a young person in an environment, like a school setting, where the authorities and the professionals in the room are basically setting it up like that, where they're like, you either do A or B, because those are your only options, and if you do C, there will be a punishment. It's like, well, of course, you're going to learn
to do
comply.
Yeah. I either have to do this thing because you're telling me to do it, or if I don't do it, you are going to abandon me in my time of need. And then if I really don't do it and I exhibit a behavior, then you're going to not only abandon me, but then you're going to punish me.
Escalate it, yeah.
Why the fuck would anybody be regulated like that? So that's where, like, our, TikTok clips are not going to encapsulate this very nuanced conversation.
But something else to piggyback off of what you're talking about, because another big feature, like, of all the complex trauma stuff, is we talk about emotional regulation is the other huge.
Okay.
So that's so interesting that in your work there's such like a focus for, and where you notice if that emotional regulation isn't cared for, isn't there, we can't really do.
Yeah.
And it's the same with my work too, and that gets skipped over so much. People are just like breathing techniques, and I'm like, there's so much happening internally for that person in that moment when they are dysregulating. The stories that we tell ourselves about what's happening and how people feel about us or ourselves when we are dysregulating. And
yeah, no, and that's where it's like, that's all well and good. Breathing would be awesome. Wouldn't that be so nice if that worked?
I just be breathing and it fixed stuff.
I don't have to think about it anymore. Don't think, just breathe. Right? And that's the other thing that I see in a lot of programming is like, it's almost like this routine. We're teaching a routine.
Yes.
Right? You do this and then you do this. That's still fucking compliance, people. There's still not, how are you empowering the individual to choose and know what is right for them? Like, so that's why I'm always like, label, model, point it out for them. Put it back to them. Your body's tense. Your voice is loud.
Yeah.
Oh, I can see that you're getting louder. Your body needs to move. Let's go move it together. Instead of like, take a deep breath and then keep counting to 5. Keep doing your math problem.
Yeah.
So I mean, that's such a big topic that I think is well criticized and should be continued to be criticized.
Yeah. I mean, we love a good meditation and a good breathing exercise. It does have its effective in it, but it's just not the end all be all. And you're reminding me of, it goes back to that, we have to figure out what's going to work for that person, because like jujitsu works for you and I. That's our place where we feel like, oh, I'm slowing down and I'm connecting with my body and I'm trusting my body to do things. And but that doesn't mean that that's what it's going to be for everybody, or that it's always going to be that for us.
Exactly.
There's going to be other times or other days where we're like, actually, I just need a yoga class.
Yeah.
Or I just need to go for a walk by myself. Or I just need this breathing exercise, or whatever it is, as long as it's helping you slow down, helping you connect, helping you feel safe in your body. And then my favorite, if you can have some fun.
Yeah. Yeah. And I love that, because I think that in some of those questions too, like there's such good questions because they're going to have really highly complex answers. There's never going to be an answer that's like really neatly tied up in a bow.
Yeah. Sorry guys, because I know as a student,
you want an answer.
Yes, which just shows like your good heart, that you're like, okay, I just want to make sure I'm doing the best course of treatment for this. But I think it goes back to exactly what Kelsey has been saying throughout this conversation, is keep having that dialogue, Keep having a collaboration with that client. Don't be afraid to share your thoughts and your feelings with your clients that you're working with in this way, and stay curious.
And question everything.
Yeah.
If you are, start with what you know and go past it.
Yep. And supervision. I
Yeah.
can't, in my trauma work, when people ask me, like, how did you, it was from talking to other therapists, bringing my cases and saying, this is where I'm at. This is what's feeling effective. I tried this. This doesn't seem, or this seems like this is where we're stuck and we're not making any progress. Keep talking about it.
I love that. Is there more questions you think that, I mean, I think we covered some pretty like overarching, but I wondered if there was other more specific questions in there. I like that you're just quietly eating pretzels in the back. I would love to eat a pretzel right now.
So this one's like an interesting one. How can a therapist help clients understand that these experiences are indeed trauma? So this kind of gives me the vibe of somebody who is listening to a client talk, and that client is not maybe saying or labeling that thing themselves as trauma, but then the therapist is in the room and they're like, that sounds a whole heck of a lot like trauma to me.
Yeah, like is the question, do I need, how do I convince my client that that's trauma?
I'm almost wondering if, that's a bit of like what their question is if I'm working with you and you're just talking about something as if it's just an experience, but I'm labeling it and knowing it to be trauma, should I bring that to your attention or should I not bring that to your attention?
I really want to know how you would handle that.
So I would play stupid a little bit with this one first. Like, I would go to a little bit of how we started. Like, I would want to ask that, like, what do they think trauma is? Especially because automatically, like, is that like a positive connotation that they have to it? Or are they like, trauma's for pussies and for the weak, and that shit ain't for me? And so, like, I think that would be a really important place to start with, is where are they operating from when they think of trauma, to the point that they don't even associate that with themselves. And especially because I find sometimes, like Tom had said, some people identify trauma as it's only a life
or death situation. And so they're like, well, me being beat by my dad throughout my life, it wasn't life or death. Like, I knew he wasn't going to kill me. I just knew he was going to beat me within an inch of my life every day. And then you're like, okay, so it's not that kind of a trauma, but have you ever considered this kind of a trauma? I guess my question to the question is, like, what will that do for us?
Yes.
Like, it's great. Good. I'm glad you, clinician, noticed that, but, like, maybe that feels good for us to see and label, but it, like, to me, pointing that out when somebody's not in a space to receive that seems like you're
Forcing.
moving too fast, like you said.
Yeah. I think that's really perfect what you said, and it brings up the observation where you would have to, as the clinician, kind of check in with yourself and trust, is that person not associating with trauma because there's a defensiveness to them that they don't want that? And if so, then respect that. There's a ton of ways that you can talk about the impact that these experiences are having on that person without having to label it as trauma. So respect the verbiage of what they're comfortable using. But that also reminds me that as therapists, and this comes up a lot when I think of abuse, the word abuse, where if we see a client who is struggling with maybe allowing themselves to take ownership, so a client that's like, well, somebody else has it worse off, I don't have any right to have my thing be called trauma.
Oh my God.
That might be really helpful for you as the therapist to let them know, like, based on my experience, like, you don't have to take this if you don't want to label it as this and that doesn't feel like it matches, you don't.
Yeah.
But I want to let you know that this absolutely does fit within my experience and what others have shared with me when they identify that as trauma.
Yeah. Let them, what I hear you saying is, let them take from it what they want.
Yeah.
Because my other question is, like, think about your own thought processes and behavior in this. Why do you need to label it so badly?
It's a great, especially if there is that pressure there of like, oh, I really want to label this as trauma for them.
Yeah. Yeah, that again, it just makes me curious of like why? What would that bring?
I had a therapist in supervision who not too long ago had an experience like that. And when it came down to it for her, it was because she was so angry for that person.
Mm-hmm.
And so she had to kind of check herself and back up the pace of it. I mean, she, good intentions, good heart of wanting to have this person know, like, this wasn't okay what happened to you, and you have every right to take ownership of it as not being. And it was like, but you're getting there before they are.
Yeah, and then you're taking up their space with your own feelings and emotions. That's something I struggle with. There are times when I feel so frustrated for my families, or I just am like, yeah, I do that a lot for Tom, but I do it in a way of like, I also sometimes want to do it in a way to empower somebody else to be like, I actually kind of think you could be a little more unreasonable.
Yeah.
Like, you've actually been pretty reasonable,
right.
and I do think you have space to talk a little bit more or bring things up. So, and I feel that, and time and place does help me connect with the people that I work with, because they I think can see that I care deeply about their scenario, but I have to be cautious that I'm not taking up too much space with my emotions, like, in the session.
You are a really good advocate. That's one of my favorite things about you.
I do be like into.
Yeah, you'd be good at it.
Yeah, I just have a lot of big feelings, and I don't know. I guess it's anger because it's coming from a place of care.
And it's helpful, especially when, I mean, that's been helpful in our relationship at times where I've been like, very like, it's fine. And you've been like, it's not okay.
Yeah, like, that's
Be pissed off about that thing.
Yeah. And if you're not going to be pissed off, I'm going to be pissed
She'll
off.
be super pissed
and I'm
off.
going to be pissed off for the next 5 years because I keep a fucking burn book and I be writing down all the shit you fucked up people be doing.
Go around angry.
You fucked me over 7 years ago. I still think about
still
that
remembers.
shit.
You fucked me over 7 years ago. She still remembers.
They're on, yeah. Yeah, I got people that fucked with Nikita on my burn list.
You're so good.
Did you see it? Did you remember when Kanye wrote his betrayal list?
No. How did I miss out on this?
I don't know, but the stuff that he wrote on there, like, okay, we're a mental health podcast, so I don't want to be, like, very blasé about,
Yay, having manic episodes?
Yeah, so, like, it's like, haha, he, because it became an internet meme, right? But, he wrote a betrayal list of, like, all the people that have basically betrayed him. And I think didn't he put, like, Hitler on the list or something, honey? Didn't he, like, put, like, somebody who's, like, dead? Like, a big celebrity figure? Can you look it up?
Big celebrity figure, Hitler.
Or, like, a person of, I don't know, some historical
I just, like, imagined,
figure.
like, a magazine cover. Hitler.
Oh, my God. Yeah, he put, like, well, one of the sad things is that on there,
although
I think
in this
he put,
day and age, Jesus Christ.
I think he put one of his daughters on that list, and he, like, tweeted it. That's what's, like, really sad about the whole situation.
Harriet Tubman.
Yeah, he put Harriet Tubman. He put, like, historical figures on his betrayal list.
And Hitler.
Yeah. It's very...
Wow.
Yeah, and so now a lot of people...
He'd be thinking about big systems, man. He's like, all of history and all of time and how the butterfly effect did affect me.
Big T, little t.
Okay, the list officially reads, I am... it's like censored for the internet, but I am one that no one person can fix. The Betrayal, indent. Kim Kardashian, I Show Speed, Diddy, Ty Dolla $ign, Harriet Tubman, Northwest, Pusha, Freddie Gibson, Kid Cudi, Curious George.
The order of these things, because I'm imagining this is how it came to him too. So like,
very stream of consciousness, yeah.
All of the first people on the list are also all people that have cut him off because of, like, Kid Cudi, Freddie Gibbs. Like, those are people that have, like, had conversations with him basically being like, what you're doing isn't okay.
yeah.
So, yeah. Anyway, you somebody can Google the list if they want to read the rest of it.
Burn list.
But, yeah, so now because, this is how we deal with really fucked up shit, it just becomes an internet meme phenomenon. Now people on the internet are, like, making videos or they're making TikToks that are like, my betrayal list.
Oh, and Patrick Star.
Oh, right. Patrick Starr's on the list also.
Oh, Patty.
Yeah, so I don't know how the fuck that came up. Oh yeah, I was talking about my revenge. All my
Yes, how
vengeful
good your-
thoughts and grudges are.
Yeah, maybe one day you'll get on Kanye's level and
I think I just need to actually write a list, and I do need to burn it. I feel like burning something would be really fun. I would like to burn something.
yeah, I think
soon.
you're onto something there.
Right? Wouldn't it be nice to do a bonfire and then just like be burning shit? Yeah, that's true. That's true.
You and the cavemen be onto something.
Me like fire. Me need fire pit.
We need to do a girls' day at Lauren's hot tub fire pit.
I want that so bad. Yeah, maybe we can try and do that in December.
Yeah.
Is there anything left on our St. Joe's list?
There's a bunch, but I feel
we
like
can come back to it if we need
there's
to.
over 30 more questions.
Oh shit! I didn't
so
realize it was that many.
there's a lot on here, and I know some of them are also speak to the same thing. So I kind of want to go through them and organize them. But I know that those were the top things in the first section. Were all about trauma.
Yeah.
And after this, I'll also let them know, like, if there's anything that we didn't answer, or we can always go back. Maybe we'll do a live version one day with them in class.
That could be fun.
That would be super fun.
That would be super fun. Yeah, and if anybody ever has any questions or follow-ups to some of these scenarios that we're discussing, like that's fun for us to talk about.
Love that.
So yeah, thanks for tuning in. We're really happy to finally be back in the studio together.
Yes. Missed you guys.
I know, it's really nice. We're gonna keep being back in the studio. Hopefully things are gonna feel a little bit more regular. But yeah, so like, subscribe, follow. If you want some therapy, go to fulllivingwellness.com.
If you want to understand what trauma is, go to fulllivingwellness.com.
Yeah, hit us up. Yeah, share it with a friend. Leave a comment. It means a lot. Shout out to our producer, Tommy Stinson. He be doing shit. Yeah, and that's it for us today on this episode.
Thanks, y'all. Be safe.